Hello, good morning. It's me, Dr. Muhammad Naseem Shirzad, and today I'm going to discuss renal resistive index. And the renal resistive index, much of the time when you are calling your radiologist colleague to perform uh, Doppler ultrasound of renal transplant patient, maybe on first post-op day or second post-op day, and they gave you some important information like you are asking from him about the collection, and but they gave you a number on the ultrasound which we call it the resistive index. What does this number means and how it is derived? So the resistive index measure actually the resistance of the renal arterial flow to the kidney. So this is the main aim of the resistive index, that it measures the resistance of renal arterial flow to the kidney. So in normal situation, the flow through the renal artery occur throughout the systolic and diastolic. However, during a variety of conditions, like for example in transplant rejection, or maybe there is some ureteric obstruction, or there may be some inflammation, so there will be a reduced, possibly when even reversed flow through the renal artery during diastole. So when this happens, the resistive index, which is that we calculate it by measuring the arterial waveform throughout the cardiac cycle, and we calculate it by measuring the peak systolic velocity minus end diastolic velocity dividing by the peak systolic velocity, and normal range for this renal resistive index is 0.5 to 0.7. This is the normal range. But the in which area of the kidney we are measuring this resistive index, it is also important. We are measuring this with spectral Doppler ultrasound at the arcuate artery, which is located at the corticomedullary junction, or we can measure at the interlobar artery, which is adjacent to the medullary pyramids, which I will show in a picture. But it is also important to have a concept of the correct sequence of blood flow through the kidney. You know that the renal artery that is coming from the aorta, it is dividing into the interlobar arteries, then it divide into the arcuate arteries, then it divide into the interlobular arteries, and then it giving apparent arteriole. Apparent arteriole are the primary arteriole that provide the incoming blood to the glomerulus, and then it enter into the glomerulus capillaries, and from glomerulus capillary it enter into the apparent arteriole, and then into the peritubular capillary or vasa recta. Now, what are the conditions in which this renal resistive index is increasing, and what are the conditions in which this is decreasing? So the differential diagnosis, if you call your radiology colleague and they give you a high value, so what differential should come in your mind? It may be due to acute tubular necrosis, it may be acute or chronic transplant rejection, it may be renal vein thrombosis, it may be drug toxicity, it may be ureteric obstruction, or it may be perinephric fluid collection. So in all these conditions, the resistive index, the renal resistive index is increasing. But in one condition where this resistive index is decreasing, and the reason for that is the renal artery stenosis. So the risky things, and that which can lead to the graft loss and even death when this resistive index is high, because renal vein thrombosis are dangerous things, the acute tubular necrosis are dangerous things. So in renal transplant, recipient with high resistive index means more than 0.7 or 0.8, that is associated with increased risk of graft loss and even death. So this is the whole detail regarding the resistive index. Thank you.